Hi friends, so here are 5 tips which we can use in our day-to-day dental practice in dental implantology field. So we are here after World Dental Implant Expo in Cochin. So it would be something like a conclusion of the what we were discussing over this past 3 days by 40 implantologists from different parts of the world. So the first and foremost thing, the important thing is when the patient comes for the treatment, we have to spend a lot of time to discuss the history, to know the history. And once the history part is over, then we have to make the conclusion about the health situation and the social, economical and all this aspect of the patient. Encourage them to speak more than we explain more. That's the first tip. So once when you started talking to the patient, when the patient gained that confidence, then you go for the examination. So in the examination portion, we'll be looking into what is remaining in patient's mouth, what we have to build up. So these two things are very important. Patient will be coming to you for a single tooth implant. They don't know where they are going to get the implant, whether the bone is there, whether the soft tissue is there, or the crown after you fix it will be matching with the neighboring crown. So these all things patient do not know. So we have to inform, after the observation, we have to inform the patient. These are the limitations. This is the second tip. We have to inform the patient about the limitations of the treatment. There is nothing wrong in that, because we are not magicians to create everything. So it will go with the scientific protocols, and whatever is possible only we promise that. Then the third tip is do proper diagnosis before you jump into any conclusion. For that you may need X-rays, you may need OPG, you may need other CBCT. So whatever is needed for that particular case, you have to get it. It is not like patient is not interested or I don't have the time. It's not that way. This protocol has to be formulated in our clinic. So whatever is necessary, we have to get it. The fourth thing is, when we do any procedure, if the patient is going for an appendix removal for any appendicitis, what the physicians do, they will send the patient for all blood tests. They should know what is the health situation of this patient before they put the blade. So same way, we should know the health condition of the patient, not from the words of the patient or words of the relatives. By the numbers we should know. For that we have to send the patient for proper blood evaluation. So once when we get the blood details, we know where is the vitamin D, we know where is the other issues, and how my treatment will be going to survive in this patient. That will be getting from that blood profile. Then the fifth thing and the last but not least is how this patient is going to do the maintenance protocol. We have done all the beautiful work, but if the patient is not going to maintain it properly, it will definitely fail. The patient has to get the information about the maintenance protocol in the first place itself. Then if it is not possible for them to do the maintenance, you should not attempt the treatment, because if the treatment, if you are not attempting, it is not a crime, it is not your mistake if you are not attempting a treatment where the treatment is not going to be successful. It's your decision. You can make the decision not to do anything which is not going to give you good result. So the patient's treatment has to be delayed until unless they are ready for accepting the maintenance protocol, because dental implantology is not something like any emergency. There are some emergency situations, I am not talking about that. Generally they can think, plan, and they can give you all the information about their availability. If they are not available in your location, they should be available to someone else. So someone else should do the maintenance protocol. Then only our treatment will be successful. So when you give all this information to the patient, what will happen? Maybe the patient will move on to the next practice. Maybe they will get more confidence in you, and they will come back to your practice. Anyway, as per the at present situation, the good treating doctors are not available to the population. So the population and the doctors, that calculation when you compare, still you will be busy with practice if you are going through the right protocols, because you will not have to fix a lot of issues coming after you do the treatment. So you will be productive, and patient will not be losing any money, any effort, any difficulties of the procedures, surgeries, and things happened because of the wrong treatment plan executed. So these are the 5 tips. Just keep it in mind. Thank you very much.